Rate versus rhythm control in atrial fibrillation is still an unsettled and often debated issue, but it is often noted that left ventricular systolic dysfunction coexists in spite of adequate rate control in AF. CAMERA-MRI study screened 301 patients with AF and systolic dysfunction to exclude ventricular fibrosis as evidenced by late gadolinium enhancement on cardiac magnetic resonance imaging. Of the 68 patients who did not have ventricular fibrosis, half each were enrolled for medical rate control and catheter ablation of AF. Pulmonary vein isolation and posterior wall isolation was the ablation strategy. AF burden in the catheter ablation group was assessed by an implantable loop recorder, while rate control in the medical rate control group was assessed with serial Holter recordings. Mean AF burden in the ablation group was 1.6%, and the mean improvement in left ventricular ejection fraction was 18% compared to 4.4% in the medical rate control group. Hence, authors of the catheter ablation versus medical rate control in atrial fibrillation and systolic dysfunction CAMERA-MRI study concluded that AF is an underappreciated reversible cause of left ventricular systolic dysfunction despite adequate rate control.